With me here today, I have Mike Willis, the Director of the Office of Emergency Management, and Scott Bookman, the Incident Commander for the Colorado Department of Public Health and Environment. And how this press availability will work is you will all be muted, and then if you have a question, just please chat it to the group chat, and then I will read those out as we go. I just want to let you know I'm able to see questions that were typed in after 10:55 a.m. So if you have something after that, please resubmit it. If there's a question that comes up multiple times and we've already answered it, I'll go ahead and just acknowledge that, and then we'll continue on to try to get through as many as we can within this 30 minutes. We'll go until 11:30 and have a hard stop then. Okay, so before we begin, I'll just have both Director Willis and Scott Bookman spell their names and repeat their titles for you.
I am Mike Willis, W-I-L-L-I-S. I'm the Director of the Office of Emergency Management.
This is Scott Bookman, S-C-O-T-T-B-O-O-K-M-A-N, and I'm the Incident Commander for the State Public Health Department.
Great. All right, so this first question is from Sam Tavachnik at the Denver Post. Has the state made any decisions regarding new types of testing, such as the blood test being used in San Miguel County? Are there any other testing methods being considered at the state?
This is Scott Bookman. We are continuing to evaluate the efficacy of different types of testing and looking at them in different phases of our response to this incident. Blood testing will have a role. Currently, the gold standard for testing is still the nasopharyngeal swab, and then the RT-PCR testing that we are currently doing to identify live virus in humans.
Great. This next question is from Taylor Summers at NBC News Radio. Last week, you told us that COVID-19 tests were going out to frontline medical workers. Have any of those results come back? If not, when do you expect them?
It's Mike Willis. No, the testing really just began yesterday and will continue through this week, so we don't have results.
And that was Mike Willis. This question is from Colleen Slevin of the Associated Press. Is the testing being done by Strive Community in Wheat Ridge today being done in coordination or help from the state?
So the state has provided technical assistance and guidance to any members of our community who have an interest in doing community-based testing. We are grateful to Stride and to all other healthcare providers who are working through providing community-based testing.
This next question is from Sam Tavachnik at the Denver Post. Is CDPHE Executive Director Jill Ryan still in isolation? When is she expected to be out of isolation?
This is Scott Bookman. Jill is working remotely at this time, like many people in the state are. She is healthy and fully engaged, and she will determine when she decides to start working in person again while maintaining social distancing as appropriate.
This question is from Karen Schwartz. The state is identifying the number of outbreaks at residential and non-hospital care facilities, but not the names of the facilities involved. Since the Denver Post succeeded in obtaining that info through an FOI, will the names of the facilities now be released as a matter of course? And also, can we be told how many individuals at each facility have tested positive and died?
It's Mike Willis. We'll continue to follow appropriate protocols in the investigative phase.
If you have questions about the number of, or the names of facilities, next question. We have that same question come through again. This question is from Dan Mika at Abbott Laboratories. Said they received approval from the FDA to start distributing COVID-19 tests that produce results within 5 minutes to the rate of 50,000 tests per day. Is CDPHE trying to procure any of these?
This is Scott Bookman. Our innovation response team is continuing to evaluate the efficacy of all of the new tests that are coming online, and we'll work with our healthcare partners to provide tests as appropriate.
This question is from Vinny Deljuice at Bloomberg News, Denver Bureau. How many ventilators and ICU beds are here in Colorado for coronavirus patients and/or others? Are the state's projected needs for 7,000 plus ventilators and 5,000 ICU beds a worst case scenario? What is the projection for hospitalizations at the peak and 3 months after the peak?
This is Scott Bookman. We are continuing to evaluate needs at peak. We have used models that have shown the worst case scenario based on our initial information. And that was where the number of approximately 5,000 additional ICU beds at peak would be required. We needed additional ventilators to support that, and that's where the number of 7,000 ventilators came from. Every day we get more information about the positive effects of our social distancing, and we will take those numbers into consideration as we continue our surge capacity planning.
This is from Carrie Harden at the Steamboat Pilot. You say mass testing capability will take a long time to build. Once that is built, won't it be too late to isolate and contain? We are already past containment.
So this is Scott Bookman. Until there is a proven treatment or a vaccine for COVID-19, we will continue to have tools in our toolbox to manage outbreaks of this illness in our community, even after the first wave breaks.
This is from Ben Warwick at CBS 4. Is 414 the current number of hospitalizations or the total number since the pandemic began?
This is Scott Bookman. That would be the total number of confirmed since the outbreak began.
This question is from John Herrick. Is the state requiring hospitals to report daily the number of ventilators, staff, and ICU beds to the state? If not, why not? And he is with the Colorado Independent.
This is Scott Bookman. We are continuing to work with our healthcare partners to get that data. Most of our hospitals have been very willing to provide that information to us. We are continuing in our efforts to streamline how that data is reported. And once we complete that, if we don't get compliance from a greater percentage of the hospitals, we do have the ability to utilize either an executive order or a public health order to get that information. We just don't believe we've reached that point yet.
This question is from Carrie Harden with the Steamboat Pilot. Is Casey's Pond here in Steamboat the 10th outbreak in an assisted living center? What constitutes an outbreak?
I do not have information on the specifics of that location, and I don't have the particular precise definition of what constitutes an outbreak, but it is when our infection control team identifies that we have spread within a facility.
This question is from Jensen Worley with the Denver Business Journal. What is the latest update on the developments of the innovation response team? Do they have any results or new products to share yet?
This is Mike Willis. The innovation response team continues to pursue a number of different avenues in an effort to bring new capability to bear. There's no specific capability at this time, but there's certainly some very promising leads.
This next question is from Blair Miller with Denver 7. Who is doing the data modeling right now? Can we see that data? What is the correct way to quantify case numbers right now if officials believe there is 5,000 to 15,000 more cases, as Governor Polis said yesterday?
It's Mike Willis. Modeling is being done by a team of professionals from the University of Colorado and the CDPHE laboratory. We really appreciate their hard work on that.
This question is from Ellis Arnold at Colorado Community Media. Some county stay-at-home orders have included friend in the list of people in other households that Coloradans can take care of for physical and mental health reasons. Does the statewide stay-at-home order allow for people to take care of young friends in other households for those reasons, or is it only family members and older adults?
It's Mike Willis. The governor's executive order covers a category called vulnerable people. While traditionally we think of vulnerable people as those over the age of 60, we do know that in our communities there are persons with access and functional needs that may be younger but are still vulnerable. We really expect people to do the right thing, and that's that voluntary compliance that the governor speaks frequently about. We know that our communities may have young people who are vulnerable, who may have access and functional needs or disabilities, and they do need our care and support as long as we can maintain appropriate social distancing and protect them from being infected.
What's being done to address the need for PPE at senior living centers?
So this is Scott Bookman. The state is doing everything that we can to procure additional PPE through every available channel. Our traditional logistics team is doing that. Our innovation response team is doing that. We're working around the clock to identify new sources of PPE. And then we distribute it through our normal channels, which means that those assisted living and senior living facilities all need to work with their county emergency managers to make requests for additional PPE as appropriate.
This next question is from Jensen Worley with the Denver Business Journal. It's been reported that the Budweiser Center in Loveland is preparing to be a temporary hospital to increase bed capacity. Are there other organized efforts to build temporary hospitals?
It's Mike Willis. Yes, there's a significant effort to identify appropriate facilities and build alternate care facilities to prepare the state for the surge. The Budweiser Center is one of the facilities that's being considered, as are many others in all regions of the state.
This question is from Joe St. George at KDVR. Has there been any indication of a spike in cases because of a Post Malone concert at the Pepsi Center? For instance, has the state seen a number of cases reported from that concert?
This is Scott Bookman. We don't have any information about any cases directly tied to that concert.
This question is from Ellis Arnold at Colorado Community Media. At this point, when does CDPHE expect the peak of COVID-19 spread to happen? And will it be a year or more before CDPHE expects community spread of COVID-19 to stop across Colorado?
So this is Scott Bookman. We are hoping that our social distancing efforts are being effective. And if they are being effective, we will push the peak later into the year rather than having it happen quicker. By pushing that peak out, we have more time to build capacity within our healthcare system so that we can care for people who come down with COVID-19.
This next question is from John Herrick at the Colorado Independent. In addition to the COVID-19 case in Denver, are you aware of any other positive COVID-19 cases in jails or prisons in Colorado?
This is Scott Bookman. I do not have any additional information on that at this time.
This is from Ellis Arnold at Colorado Community Media. Is it correct to say that if someone recovers from COVID-19, they have immunity for coronavirus/COVID-19 from that point on?
It's Mike Willis. It's too early to make a statement pertaining to that. We just don't know enough about the disease yet.
This is from C. Vanderveen. Is anyone getting a better idea of the sensitivity of the current COVID testing taking place in Colorado? And yesterday, Colorado performed about as many tests as it did days ago. When will we see the massive influx of testing promised by the federal government?
This is Scott Bookman. We are continuing to see challenges around specimen collection for broader community testing. and we are prioritizing the testing that we can do within our healthcare systems and within hospitals themselves so that we can make the best treatment decisions and also can make the best decisions about where patients need to be in those healthcare facilities.
This question is from Andrew Villegas. Is CDPHE tracking the number of people in Colorado getting COVID or getting seriously ill and dying with underlying medical conditions? If so, what are the specific conditions? Is it like elsewhere, so diabetes, obesity, hypertension, etc.? How about smoking or vaping?
So this is Scott Bookman. Like we have seen in other countries, we know that people are more vulnerable and susceptible to COVID-19 if they have pre-existing conditions. We are continuing to learn more about how this illness impacts different groups of people, and it is too soon to really know what that data looks like.
This question is from Ben Warwick with CBS 4. Does CDPHE have a confirmed number of recovered cases in the state?
This is Scott Bookman. We do not have that number at this time.
This next question is from Aaron Prater. Can you give any insight into why El Paso County continues to be the top state when it comes to coronavirus deaths, or the top county?
This is Mike Willis. I don't think we have any evidence that that's the case.
This question is from Karen Schwartz. My understanding is that the data posted on the CDPHE website reflects only state testing. If that's correct, why are private testing companies not being required to report their findings? Wouldn't that provide a clearer picture of spread and demand?
This is Scott Bookman. By Board of Health rule, everyone is required to report all novel coronaviruses, including COVID-19, to the State Public Health Department within 24 hours of identifying that positive result. So we are getting that information. There is a lag in reporting, as there is a backlog at many of these private labs now, but the information that is reported on the CDPHE website does include both testing done at the state lab and at other labs.
This question is from Blair Miller at Denver 7. Do you have a number of hospital or healthcare workers who are infected?
This is Scott Bookman. I do not have that information at this time.
This question is from Janet with 9 News. Is there a way for people to donate PPE? There are people 3D printing masks and things like that. What would it take for those things to be used in a hospital setting?
A two-part question. This is Mike Willis. The first part is yes, please use the website helpcoloradonow.com, and you can go on there and find ways to donate PPE or other materials. And then the second part of your question is there is a board, and I may ask Scott to help answer this, but there is a board process to vet new PPE methods to make sure they're safe.
Yeah, so this is Scott Bookman. We are working with our academic partners. We're working with our innovation response team to really look at all the new things that are coming out to make sure that they are safe. And as soon as we identify that they are safe, we are going to do everything we can to get them into the hands of those who need them.
Thank you. And I just want to make a quick clarification on the website. It's helpcoloradonow.org.
Oh, sorry.
No problem. Okay. This next question is from John Herrick. Research indicates air pollution can make COVID-19 symptoms worse. Is CDPHE considering any regulations on oil and gas drilling, such as a pause on emissions permits? And he's with the Colorado Independent.
It's Mike Willis. Yeah, I think air pollution generally undermines all health conditions, but no, there's no current discussion about changing regulations for the oil and gas industry.
This is from Barn Media and Brian Ulmer. I know several state legislators have sent a letter to the governor regarding my question, but is there any news on when and if chiropractors could be deemed essential and added to the list?
It's Mike Willis. We continuously review the list of essential functions and essential services, and I can't speak specifically to chiropractors at this time.
This question is from Karen Schwartz. Yesterday, the number of outbreaks at residential and non-hospital health facilities went from 10 to 14. Can you identify the 4 new facilities?
This is Mike Willis. We typically do not identify the facilities until the investigations are complete, so we won't name them. We can tell you that there are healthcare facilities. There are 2 in Larimer County, 2 in Weld County, 2 in El Paso County, 2 in Denver County, 2 in Arapahoe County, 1 in Chaffee, 1 in Adams, 1 in Routt, and 1 in Jefferson.
This next question is from Luke Runyon at KUNC. Back to creating overflow capacity, what other facilities besides Budweiser are being considered, and where are they? Any in Eagle County?
It's Mike Willis. We're considering facilities in all geographic parts of the state. I think it's probably premature to discuss specific locations until we have an opportunity to speak with the owner of the facility and the communities that those facilities are in.
This question is from Aaron Prater at the Gazette in Colorado Springs. The CDC is considering changing the official guidance to recommend the general public to wear masks while in public. The new guideline would call for using do-it-yourself cloth coverings, leaving the N95 and surgical masks for healthcare workers. Oh, sorry, I have to scroll down farther. I apologize, Aaron. Does CDPHE recommend that the general public, including those who are healthy, use face coverings while in public amid the pandemic to help lower the transmission of COVID-19? If so, under what conditions would the CDPHE recommend wearing masks? If masks are not recommended for healthy people, why?
This is Scott Bookman. We are continuing to follow the guidelines that come out from CDC, who are the national experts in this. And if they make this recommendation, we will certainly see what they recommend and then make our own recommendations and guidance for the larger public in Colorado.
This is from C. Vanderveen. When will Colorado start reporting data on total number of recoveries?
This is Scott Bookman from CDPHE. We are working with our local public health agencies and with our partners in the healthcare environment to identify the best way to start identifying recoveries. It's a slightly complex number to get depending on hospitalizations versus those who aren't hospitalized. And so we need to do some work to understand the best way to report that.
This is from Vinny Del Giusi at Bloomberg. How many deaths have been tied to the high country?
Vinny, Mike Willis. I don't have in front of me the specific geographic breakdown of the death.
This is from Ellis Arnold at Colorado Community Media. Oh, okay. Does the daily number of hospitalizations given on the state's website represent current hospitalizations or people who have been hospitalized since it began? He said his audio cut out, and so it's the total number since it began. Marianne Goodland from Colorado Politics. She asks, according to CDPHE data, El Paso County has more deaths than any other county. Are state officials investigating why this is?
This is Scott Bookman. At the state level, we continue to work with our partners at local public health agencies across the state to understand how the disease is impacting different communities.
This is from Joe St. George at KDVR. Right now, the hospitalization rate is 414 patients. We know most are still in the hospital because the average stay is around 20 days. When does this number sound an alarm? At 800 patients hospitalized, 1,000? Is there any concern about our border? Other states have done border checkpoints. Is that being considered here?
So this is Scott Bookman. We are working with our healthcare system every day to do everything that we can to build capacity within our hospitals, within the larger healthcare system. And then, as Director Willis indicated, looking at ways to expand into alternate care facilities across our state. And so we are working collaboratively across that continuum to provide care as cases surge.
This question is from Jason Oslander. When will broad-based community testing begin across the state?
It's Mike Willis. Our innovative response team continues to work on ways to do that across the state, and we continue to work with the federal government to procure enough test capability to do the mass testing that we strive to do. I cannot put a specific timeline on that.
This is from Blair Miller at Denver 7. Now that we see that spread in 47 counties, we can see that many counties with 0 cases are rural and low populated counties with few healthcare resources. When will some of those counties see more testing to confirm whether there is spread of COVID-19 there?
This is Scott Bookman. We are continuing, as we've said previously, to do everything we can to expand testing across the state and to provide access to all that need it. At this point, we're focusing our testing efforts on healthcare institutions where people are hospitalized, and then providing testing also for healthcare workers and first responders to ensure that our safety net stays intact. Our message to people who are symptomatic is stay home and call your healthcare provider.
This is from Brian Ulmer at Barn Media. On March 24th, officials from CDPHE urged Coloradans not to engage in open burning activities during the current COVID-19 response. Is that still in effect, even though the practice is used in agriculture areas in rural Colorado as we prepare for irrigation ditches to move water for the 2020 growing season?
This is Scott Bookman. Any of those recommendations that were not made out of the unified command here, so I can't speak to those specifically.
This is Mariah. It's about 11:27, so we'll take questions for a few more minutes. This is from John Herrick. The expected shortage of ventilators went from 7,000 to 9,000 to 10,000 between Friday and Monday. What changed?
This is Scott Bookman. I've never heard the 10,000 number. We are striving to, based on our modeling, we know that we need to create about 5,000 additional ICU beds in the state to handle the potential peak. We have set a target of 7,000 ventilators to ensure that we have enough backup ventilators in case we need more.
Great. I want to acknowledge we got the question about borders and if we're considering checkpoints again, just to...
It's Mike Willis. At this point, we're not considering closing the borders.
This question is from Seth. Is there any initiative to implement any testing that would indicate past infection to identify those who may have already had and recovered from COVID-19 so that we have a better idea of how many in Colorado have been truly impacted?
We are continuing to evaluate, and over time, we will make decisions about the right testing strategies.
This question is from Karen Schwartz. CDPHE has started putting COVID-19 info on its website in Somali, Vietnamese, and some other languages, but some of these populations are unlikely to have access to the internet. How is information being disseminated to these communities? Are employers required to post COVID-19 info on their workplaces, in their workplaces?
It's Mike Willis. No, we're not requiring employers to post COVID-19 on their workplaces, although that would be a good practice. We certainly want all our communities to be informed as best we can, whether that's through their places of worship or through their community centers. We ask everybody, all our community members, to spread the word accurately and in as many languages and communications as possible.
And this question is from Colleen Slevin at the Associated Press. Is the state focusing if the state is focusing the limited testing kits on those hospitalized and healthcare, does it make sense for independent groups to do community testing at this point?
So I think we need to expand testing as widely as we can. The limitation currently to testing is really based on the ability to get personal protective equipment and to conduct that swabbing. And so we are working with all of our partners to expand testing the best that we can. When our resources are limited, we will continue to focus it on those higher priorities like hospitalized patients, healthcare workers, and first responders.
All right, so that brings us right up here to 11:30. So thank you all for joining us again. I'll just have Scott and Mike both state their name and spell it and state their titles as well.
Mike Willis, W-I-L-L-I-S, Director of the Office of Emergency Management.
Scott Bookman, S-C-O-T-T-B-O-O-K-M-A-N. I'm the Incident Commander for the State Public Health Department.
All right, thank you so much. And should you have any follow-up questions, you can always feel free to email our media email address as well. Thank you all so much, and we will talk to you next time. Thank you.